Uh-oh, guess what day it is? Guess what day it is? Huh? Mike, what day is it, Mike?
I'm Michael Andrew Weston. Welcome back to Hump Day Health Talk. I'm so excited to have the first exclusive interview with our new Chief Medical Officer, Dr. Luther Walls. Thank you so much for being here with me. As you all know, it's Heart Health Month, right? It's American Heart Month. And I couldn't think of a better person to talk to about heart health, but specifically talking about the blood. What comes to your mind immediately when you talk about the blood in terms of heart health?
Yeah. First, thanks for having me. Really appreciate it. But the first thing I really think about when it comes to blood is really how much we use it for, just in our everyday medical practice, right? We go as far as getting diagnostic information. How well is your diabetes controlled? What's going on with your kidney function? What's happening with your liver? We use it to figure out what the sex of a baby is. We see if there's sort of any sort of infections going on. You give it for blood products if folks are interested in that. It is really crazy how much we can use with this informational highway that everyone has got circulating around with them.
It's so interesting. I don't want to derail us, but you said you we use it to find out the sex of the baby, and I'm used to the ultrasound and go, there it goes. And so, you tell me that it's actually news to me.
Yeah.
That's so interesting in terms of our blood and the heart. What are the risk factors?
Yeah. So when I think about the heart, I think about blood flow, right? So, of course, we know that blood is flowing in and out of the heart, going to every organ, making sure that we're able to keep walking, talking, breathing, etc. But what happens with all of the kind of chronic conditions, such as diabetes, high blood pressure, is that over time, the arteries, the veins, these things that kind of help keep our organs healthy start to decay in certain ways. And so there's a lot of risk factors that can lead to that kind of decay. Some that take longer, some that happen sooner. Some of them are genetic and familial. We know, of course, that while diet and exercise play a huge role in our ability to control our blood pressure, and make sure that our blood sugar levels are normal, we also know that there is a genetic component to it. So where we often see mom, dad, grandma, grandpa, aunts, and uncles with these things, sometimes we find it earlier or later in life, kind of depending on our habits. Those type of things developing in ourselves as well.
The genetic component. Can some of these trajectories in terms of our blood and our body and our hearts, can they be reversed?
Yeah, great question. A tricky answer. The nuanced answer that I would say is that some things we can decrease the risk for sure. Others, it's a little bit harder to reverse. Fortunately and unfortunately, the genes you get are the genes that you get. There's not a lot that we can do to overcome our genetic makeup. However, if you know you kind of catch things early, you're going to your doctor, your provider regularly for checkups, you're talking to your family about, hey, what are the conditions that we see a lot in our family? Those are opportunities to catch things earlier and intervene before you have a more deadly or serious or significant event like a heart attack or a stroke. One of the things that we don't talk about enough in medicine is the impact of diet and exercise. We will mention it, but really underestimate its value to help control, prevent a lot of these things. Just improving diet and exercise alone can change your blood pressure about 7 to 10 points. And it has huge impact for even combating things like depression, combating things even like when it comes to your sexual health. A lot of my male patients will have concerns about erectile dysfunction, and the first thing we're talking about is what's going on in the rest of their body. Because if your pipes, meaning your arteries, are not together the way they need to be, the blood flow is not going to get to where you want it to be.
A good interviewer asks questions. Me, I didn't have to ask questions because I have a good interviewee. So, Dr. Ross, I just want to thank you for taking time again to sit with me, to talk to me about this, talk to us about this. Thank you all so much for joining in for another Hump Day Health Talk. Dr. Ross, you have anything else you want to say before we head out of here?
Of course, I'm just so happy to be here. I'm happy to be with Care Alliance. I'm looking forward to continuing working with all of you all, as well as seeing the community coming into our clinic, and happy to talk about any of these questions in an appointment.
Get an appointment. Thank you all so much.
Take care.